And I went in to see this guy, and I'm talking to him, and the whole time I'm explaining to him what I'm feeling and where it hurts, and he's pushing around. His eyebrows are kind of screwing up and things aren't kind of adding up, and I can just see it on his face that this just isn't, nothing, 2 and 2's not adding up here. And he says, would you excuse me for a minute? I've got a partner over in the other room and I'd like to go talk to him for a moment. I said, sure. So I'm sitting there and he's gone for about 5 or 10 minutes, and he comes back in. He says, you said you hadn't eaten anything since yesterday. I said, yeah, I just haven't felt up to eating. I haven't eaten since noon yesterday. And he says, well, my partner's doing endoscopies right now. I'd like to take a peek in there and see what's going on. He says, what would you think of that? And I'm thinking to myself, well, yeah, let's go take a look and see what ulcer or whatever else is going in, because I'm sure that's what it is, and we'll get me on the right medicine and we'll be done with this. And that was the thought that kept running through my mind, is how am I going to get through this, because I can already tell this isn't good news. And he puts the folder down in his lap and he opens it up and he says, Mike, I don't like what I saw. And he flips over the cover sheet and here's this picture of the tumor. And, my gallows humor is, you know what, Doc? I'm not liking what I'm seeing either. You did not have to be a physician to recognize it as cancer. I mean, it was bleeding, it was ulcerated. He said he'd taken a biopsy while he was in there. It'd be the next day until he got it. He said, but you need to go get a CT scan. And then he said, and I think it would be good to go talk to a surgeon.
Our family carried Tums in our pockets all the time. We didn't really, I don't remember much after my teenage years where I didn't have Tums or some sort of antacid in my pocket. Grandpa went through them like they were candy. Dad took them, I took them, and so I didn't really know that there was anything wrong with it. Everybody did it, and they did it for years. So I really didn't know much about EC at the time that I was diagnosed. Didn't know that it was really caused by esophageal reflux. It was just bad luck.
So Sunday I was diagnosed. Tuesday I went in and saw the gastroenterologist. Wednesday I was able to get in and have a CT scan. Thursday I had the scheduled appointment with a thoracic surgeon. And unfortunately, she was the first one to see the CT scan. And she was the one that told me, I'm sorry, there's nothing I can do because it's metastasized to both lobes of the liver. Nobody said stage 4 yet. They just said, can't help you. Guess what? You get to go meet your next physician now. You need to go see an oncologist. He says, what we've been looking at is the fact that we've known that really the way to get rid of cancer would be to get the immune system to recognize cancer as being, a foreign body in your system. But cancer has a way of cloaking itself. He says it's got like a stealth system that it puts on, and it hides itself from your white blood cells. So it's actually called an anti-PD-L1 immunotherapy, and that's what he was able to get me onto. I feel really blessed that I was able to get onto it. So I think I went off of chemotherapy in August, and I got onto the immunotherapy about mid-October of 2013.
We started off with a series of Taxol, carboplatin, and 5-FU, which was part of the experimental protocol. They had radiation done at the same time. And then 5 weeks after I ended those 2 therapies, I went in for the surgery. The surgery was certainly not something that anyone anticipated. The doctor had told us that it would be a prolonged surgery, 8 to 9 hours. And so while I slept, my family prayed that I would make it out alive.
It was keeping me alive, and it was keeping me alive in ways that nobody, in their wildest dreams, the doctors that I would talk to down at the hospital had never hoped for the kind of reaction that I was having. Within the first 3-4 months, my CT scans went from being able to show this 6 or 8 spots in both lobes of my liver to all of a sudden none. I mean, it literally went from one scan, they could see 6 discernibly, the next scan they could see nothing, to the point that my oncologist was really questioning the scan. And he had me go back and pull all the scans that I had had for the last year and 2 months. And not only himself and a radiologist, but himself and 2 radiologists sat there and went scan by scan by scan through each one, looking at my liver, trying to figure out what had happened. Plain and simple was, it was gone. All the tumor spots were gone. Nothing was showing up. Pretty much every medical university website that I could find that had anything that they posted about esophageal cancer, whether it was, most of them are ad hoc. It's the same thing. It's an NIH document from, back in the late 90s, early 2000s, which I think is totally out of date these days. This is 2015. We are so far advanced, just in the last 5 years, let alone 15. You just can't look at that old data. The old statistics that would make you weep are not what you need to be looking at now. So I would go out there. I wanted to get on forums. I wanted to find out what other people were dealing with. Where were they in their treatments? And then I would talk about this treatment that I was on, this immunotherapy treatment. Nobody had heard of it.
Every 3 months, 6 months, 9 months, a year, 18 months, the doctor would send me for a PET scan to confirm that I did not have cancer again. And it was really a scary thing to have happen. It seemed like I always got the Thursday appointment and they wouldn't give you the results until the next Tuesday, which meant you had the 5 days of just overwhelming fear trying to think about what happens if this is back, and how do I deal with that? As the years have gone by, of course, I don't do those tests anymore.
I'm not supposed to be here right now talking to you. Statistically, the old statistics from the 90s, I'm not supposed to be here. I was going to be very happy. When I first got told that I was going to have this, that I had this cancer in 2013, I was thinking, get to Christmas 2013. I want to get through Christmas, maybe get to New Year's. It would be nice to see my 53rd birthday in 2014. That would be good. My son's going to get married? I got to stick around for that. That was this past March. I needed to make it to March. I'm doing fine. I'm way past March. It's July. It just keeps going. Where are the drugs at now? Where are the treatments at now? 2 years is a lifetime when it comes to the advances in cancer treatments.
Having had my mother-in-law pass away from the disease, my father died from the EC, they didn't have symptoms. My dad was diagnosed when he was eating a hamburger on 4th of July 10 years ago and suddenly couldn't swallow it. And unfortunately, that's the time when most people find out that they have EC. I was lucky. Lucky that I had a hiatal hernia and it was causing me enough pain to go get it fixed, because if I hadn't have done that, I wouldn't be here today.
We don't understand a year and a half later now why we're not hearing more people talk about this form of treatment. We've certainly gotten onto websites and we've seen that all the major pharma companies are doing this. Anti-PD-L1 immunotherapy drugs as one form of attack. Everybody out there in the market has got something in the works. It's getting the word out about esophageal cancer. And you start to realize there's an awful lot of people that have esophageal cancer, and there's an awful lot of people that know people that had esophageal cancer. And you start to go, well, why have I never heard of this until I got it?